Hello, friends. Welcome back. Have you heard of Ozempic and Wegovy, also known as semaglutide, a GLP-1 receptor agonist medication for weight loss? Perhaps you're on one of these medicines or you have a loved one who is, and you're wondering, does it have mental health consequences in addition to its benefits for weight loss and metabolic syndrome? There's some important research on this question that I'd like to go through with you, and I think the results will surprise you. So let's jump in together. As a reminder, I am a doctor, but I am not your doctor, so please make sure to get individualized medical advice from your clinician. This is only educational and entertainment. All right, so this is the study that we're going to examine together, which was published in August of 2024. And what they tried to look at was whether semaglutide and liraglutide, two GLP-1 receptor agonists that are used for weight loss as well as diabetes, whether these medications had any negative side effects related to mental health, specifically suicidality. And here's what they found out. First of all, you have to remember that there were two medicines discussed here, one called semaglutide, also known as Ozempic or Wegovy, and another one called liraglutide. These medications are, as I mentioned, GLP-1 receptor agonists. They're very popular. They're blockbusters. And Vic is another name for liraglutide. These medications are approved for type 2 diabetes originally, then they got approved for weight management. And what they do is they mimic this hormone that's already in our bodies called GLP-1, and that affects our appetite as well as the way insulin affects our body and is secreted, as well as it delays gastric emptying or the way your stomach holds on to food, which makes people feel full longer. And we also have seen that when you're on these medicines, people who have diabetes especially actually have fewer cardiovascular events like heart attacks and strokes, which is really amazing. So these are very important drugs. So the question is, in addition to their benefits, we are starting to see different possible side effects. Another video that I did here was about ophthalmological or visual side effects of these medications and whether that's something to worry about. Here, we're going to focus on mental health. What we know from past research is that and suicide semaglutide and C, particularly in a population of people who have diabetes or obesity. What's unique about this study is that it actually included people who took the medication off label, meaning not prescribed for these two indications. And in that sense, the study I'm going to go over with you mimics a normal clinical outpatient setting where people will have access to this medication for a variety of reasons, some of which would be that they just paid for it themselves, or maybe they didn't meet the technical criteria, but they really wanted it anyway. And that is a substantial fraction of the people who are on these medicines. So this study in JAMA Network Open, what they did was they had about 3,000 people, and they took a bunch of clinical trials, and they analyzed that data and pulled it together for about 3,000 people. This was a World Health Organization global database. And what looked at was adverse events or negative events that happened to people after they started the medication. The question they were looking at specifically was, do the people who were on these GLP-1 medications have differences in their outcomes for suicide as compared to people on other medications? And the two specific types of suicidality were suicidal behavior as well as self-injury, like cutting or scratching. And what did they find? They had an increased risk of suicide that showed up in the odds ratios of 1.45. What that means is that there's a 45% increased odds of seeing this significant disproportionality signal for people who are on semaglutide. And this was also true when they looked at people who were on semaglutide as compared to other diabetes medicines like metformin, Flozin, category of medications, and something called orlistat. And the reason that's significant is because they're trying to show that even in populations that are also on these metabolic type medications, you see a difference for the people who are on semaglutide. They also showed this effect for people who are on semaglutide and antidepressants and benzodiazepines, which are medicines that are given for anxiety. So what that means is that this effect that they found is also there when people are on treatment for depression and anxiety as well. So the effect can't really be explained away by people just not being treated for depression and anxiety. And specifically when they looked at people who had been on antidepressants, there was a 4.45 odds ratio or a 345% increased risk of having this kind of an adverse event reported of suicidality. And then for benzodiazepines, the anxiety medicine, it was 307% increased odds. So what that means is that when we look at the particular subpopulation of people who are on these psychiatric type medications, you have even higher risks for suicidality. That's hard to interpret on its own, but what they said was this study is suggesting that people with anxiety and depressive disorders may be at higher probability of reporting suicidal ideation when medicated with semaglutide. That's their interpretation of this data. But we can go a little bit into more depth. Specifically, one thing that's interesting about this paper is that this effect was not observed for the other GLP-1 medication, liraglutide or Victoza. It was only observed for semaglutide, and that's pretty odd. It's really hard to explain away the finding because you might want to just say this increased suicidality signal is just coming from all these GLP-1 medications, whereas in fact, we're only seeing it in this study in semaglutide patients. However, past research has shown that liraglutide is also associated with an increased risk of suicidality. Liraglutide is not exactly off the hook, but for this study in particular, we're noticing something specific to semaglutide. And like I mentioned before, we're seeing this effect for semaglutide even as compared to people who are on other diabetes and weight loss medications like metformin. So we can't just say, oh, there's something about this population of people who are on these types of medicines that is causing this effect. It seems to be something specific to semaglutide. And looking at this a little bit more deeply, I think obviously we need more research. We need a larger study, more than 3,000 people, and we need better controls. And most importantly, you have to know that this study was not causal. It was correlational. It was specifically a case-controlled study design. This was not a randomized controlled trial. We cannot infer causality. We cannot infer that semaglutide causes people to feel more suicidal. That is not strictly or logically allowed by looking at this data. How can we explain this data then if we can't assume causality? If we can't assume semaglutide causes people to feel more suicidal, what can we then do with this information? I think there's another explanation, which is that people who are unique in this study were the people who were using the medication off-label. And that was really what was unique about this study compared to past studies, as I mentioned before. So what is it about people who are off-label using semaglutide? They tend to be younger and they tend to be female. And both of those things are independent risk factors for having more depression and anxiety. So we could possibly explain this entire paper by just looking at the unique population that takes semaglutide. Younger people and females are at a higher risk of these conditions like depression and anxiety, and therefore you're going to expect more suicidality for a study that includes off-label semaglutide users as compared to semaglutide users who are not off-label, meaning that they meet all the criteria for diabetes or obesity. So that's one interpretation of how we could explain away this finding. However, the uniqueness of the signal for semaglutide is hard to explain, and the uniqueness of the signal as compared to other medications like metformin and orlistat is hard to explain. Why would this be happening? We have a little bit of a unexplained conclusion here, but what these correlational studies are good for is generating ideas or hypotheses for future research. Just like you can't find a needle in a haystack just by sticking your hands in there very easily, you want to start with a magnet. And a correlational study can sometimes increase your prior probability of a hypothesis being true, and therefore a study like this can be a magnet. Now, on the other hand, it could just be totally spurious and the entire finding could be an artifact, but it was a well-designed study and it does require further research. That being said, I think there are lessons for clinicians as well as patients. For clinicians, they should definitely carefully screen patients for mental health needs before prescribing semaglutide. As well, they need to make sure that there's adequate informed consent. The clinician needs to go slowly and make sure that patients understand possible risks and benefits. And then when somebody's on this medicine, they need to have regular mental health assessments to make sure that things are not getting worse. And if they are getting worse, for example, if you have a patient who has depression for the first time in their life while they're taking semaglutide for the first time in their life, that's hopefully going to make the clinician think a little bit about whether they should discontinue the medication and see if things get better. But overall, as with many things in medicine, there's an art more than a science here, and we need to have customized, personalized, and informed decision-making between a clinician and their patient. Now, how about the overall benefits of weight loss and improvements in diabetes and heart disease versus these risks of increased suicidality? That's something that, first of all, we need to consider in light of the fact that we don't even know if the risk exists. All we have is a correlational signal here. And number two, the benefits are quite substantial. And that's the kind of thing you want to discuss with your clinician. And now from the patient's perspective as well, and families, you want to stay vigilant for any changes in mood or behavior, and you want to report them to your clinician right away. Thanks so much. If you've enjoyed this and you want to see more videos like this, please again subscribe. And if you want to join my free newsletter, check out medicalwisdom.org. Thanks so much.